In this video, we will be going over agonists and antagonists, specifically what their differences are, what they do, and how they function. So starting off with the definition for agonists, they're molecules that bind to receptors and activate them, mimicking the effect of endogenous neurotransmitters. Antagonists, on the other hand, are molecules that bind to receptors but do not activate them, blocking the action of endogenous neurotransmitters or agonists. Their mechanism of action for agonists includes that they bind to specific receptors and produce a physiological response. Antagonists, however, bind to specific receptors without producing a response, preventing agonists from binding and activating the receptor. In terms of the types, there are a couple different types for both agonists and antagonists. For agonists, we have full agonists, which fully activate the receptor to produce a maximum response. We also have partial agonists, which, as the name suggests, partially activate the receptor, producing a less than maximum response even at full receptor occupancy. For antagonists, the first type are competitive antagonists, which compete with agonists for the same binding site on the receptor. We also have non-competitive antagonists, which bind to a different site on the receptor, altering its function so that the agonist cannot activate it. Regarding clinical uses for agonists, they are used to mimic or enhance the action of endogenous neurotransmitters, treating conditions such as pain, asthma, and Parkinson's disease. For antagonists, they are used to block the action of endogenous neurotransmitters or agonists, treating conditions such as hypertension, anxiety, and overdose. And lastly, the effect on receptor activity for agonists will cause an increase in receptor activity, leading to a physiological response. Antagonists, on the other hand, decrease receptor activity by preventing activation, thus inhibiting a physiological response.